Hi, this is Elliot Martin,
And I'm Becky Hatfield.
and we're coming to you from opposite ends of the country today to talk about Medicare
We're asking,
and answering all your questions related to Medicare so that way you can make an informed decision. This is the Medicare Navigators Podcast. Hi there, I'm Elliot Martin. I'm with Martin and Associates Insurance Services, and we're an independent insurance agency. We're located, our main office is in Irvine, California. We started in California, but over the years we've developed and come to get about over 30 different state licenses. So really we operate throughout the entire country, helping all of America's retirees with their Medicare health insurance decisions.
hi there, my name's Becky Hatfield. I'm over here in North Carolina. I am a stay-at-home mom, and I'm also the social media manager for Martin and Associates.
All right. Very good. Welcome in, everybody. Thank you for joining us for the Medicare Navigators podcast. We're into month 2 of recording here in February, and I just can't believe it. Becky, just thinking about it, you're almost 3,000 miles away from me today. And I know you've got plans to come out to California soon, so we're really excited to see you soon. How have things been going?
Good. We have just come out of an extremely cold snap over here in North Carolina. We were down in the teens and the 20s.
Oof.
But it refused to snow. And so people were buying snowmaking machines off of Amazon, and they were creating their own snow, which apparently you can do. I mean, I guess the ski resorts do it all the time. But we would be just driving around town and people had created like little mini sledding hills in their driveways
Oh,
because
that's
it was
fun.
so cold. So that was fun, but it's a little bit warmer now, which is
Yeah.
nice.
Yeah.
So, and I'm also very excited to come out to California, and who knows, maybe we could actually have one of these conversations face to face in
Hey,
real
that's a really
time.
good idea. We should make note of that and make it happen.
Yes. I also wanted to talk to you real quick about our shared hobby, which is gardening. We
Mm.
both love to garden. We're in very different climates, obviously. Are you growing anything right now, or are you waiting until like spring and summer?
So I'll probably start soon. We actually got a from my wife's aunt. She bought us a. Have you ever heard of Arrow Garden? Which is
Oh yeah,
like
is it like the tower thingy?
yeah, it's like a hydroponic. In you can basically grow your herbs and different vegetables and things indoors using this mini hydroponic system, and it's got like a little light on it and little a water filtration system. So we've been starting with that, and might as well start with that. You can do it indoors. But probably going to start up some tomatoes and things like we'll see. In California, we can start it pretty early. I think I'm zone 9B, 9A, 9B. I forget what exact zone, but you can probably start things pretty early in before it the winter's really before the winter's over, which is great.
I know. Well, I mean, it's questionable if California, where you guys are, even has winter. It's more of just
Yeah.
like, mild, like 50s, 60s.
We might get some
So,
frost on the grass in the morning sometimes, maybe 4 or 5 days in the ground. There's like sometimes it gets a little frosty on the ground, but that's about it, all we're getting. Um,
wow.
yeah.
I think I just haven't ever gardened in California. So in my mind, it's like this lush paradise that never gets cold. So
Yeah,
it's crazy that you guys
relative.
actually get frost.
Cold is relative.
Yeah.
Yeah.
I know. It is interesting. I get zone envy sometimes because I'm in zone 7B, and so I think about, oh, if I were in this zone, I could already be growing all of this. But
Yeah.
I'm pretty blessed because a few years ago we got a greenhouse.
Mm.
So I'm able to start a lot of things really early as
Oh yeah.
well, just
That's
in the
cool.
greenhouse. So I have a lot of stuff growing out there right now, which kind of helps with the winter blues because it's like, even though it's gray and everything's kind of dead, I still have stuff growing,
Yeah.
which
It's
helps me
exciting.
get through the winter. So
Awesome.
I know gardening is one of our shared hobbies, so it's fun to chat about. So there's not really a great way to segue from talking about gardening to talking about Medicare.
I'll have to think
But I
about
think
that
we
one.
just kind of got to jump into it.
Awesome. Let's do it.
I wanted to ask you, there's a lot of changes coming down the pike this year for Medicare.
Mhm.
And I know people have been having a lot of questions about, different statements they're getting in the mail and different things they're seeing on the news. One of the things I wanted to ask you about was the Inflation Reduction Act. Can you give me a Reader's Digest version of what that is?
Yeah, so the Inflation Reduction Act, the main focus of the legislation that passed for Medicare specifically is really tied to the prescription drug plans, which is Part D as in Delta of Medicare. So what has been happening, and there's, it's like a 7 or 8 year over time, there's going to be things that are going to take and go into effect. So over time, there's going to be all these changes, but really for 2024, one of and actually maybe let me take a step back. Last year there was a cap, I think, on insulin. A lot of different insulin. There's a $35 a month co-payment cap for a lot of insulin. This year there's a maximum out of pocket now on the prescription plans, and it's going to it's going to lower next year. So that's one of the changes, because previously, Medicare prescription plans, there was never any out of pocket limit. So somebody would just have to keep spending and spending and spending on prescriptions throughout the entire year with no stop to it, really. And then things just restart January 1st. So that's another change. And then one of the other things that's going to be happening gradually over the next 4 or 5 years is there each year there's going to be like a handful of real expensive brand name medications that are going to be up for negotiation, basically. I think it is what it is. So certain people who are taking these expensive medications, there should be some good some positive changes. But of course, as with when legislation passes, it's a series of trade-offs, right? So of course there's some positives to it, but there might be some changes in the market that we'll see. So we'll just kind of have to see what the market looks like. And my guess is and kind of the consensus guess for future is slimmer formularies, meaning prescription plans are going to cover less and less prescriptions, and then higher co-payments, or I'm sorry, higher monthly premiums for plans
Hmm.
just to be enrolled into the plan. So we'll see what happens. I think it's a net positive, I think. But we'll kind of have to wait and see, what the verdict is on that. So that's the 30,000 foot view of the Inflation Reduction Act, of kind of what it is affecting on the Medicare side of things.
Okay, sounds good. That makes sense. So I'm reading here, it says Part D enrollees are no longer required to pay 5% coinsurance after they reach the catastrophic threshold.
Yeah.
Um, can you explain to me what the catastrophic phase of coverage or threshold is? That sounds kind of scary.
Yeah, so on these prescription plans, really there's 4 stages that somebody has to kind of go through throughout the year. And most people actually don't have to go through stage 3 and 4. Most people stay in either stage 1, which is the deductible stage, or they go into what's called the second stage, the initial coverage stage. So I think the stats like 60 to 70% of individuals never get past stage 2. Okay, the third stage is what's called the donut hole, or the coverage gap, and then the fourth stage is the catastrophic. That's the or when that has historically been 5% of the cost. So if somebody gets their way through to the last stage, for the rest of the year, they would have still had to pay 5% of the retail price of their prescriptions throughout the rest of the year.
Mm,
So that's why I say there's never been an out of pocket limit, is because even when somebody goes through to stage 4 into the catastrophic stage, they're still paying 5% of their prescription costs. So
mm,
that's what that is. So in 2023, I'm sorry, in 2024, this year, that once somebody gets to stage 4, they're done paying out of pocket expenses for the rest of the year. So really, for our clients, that means that if they spend out of their pocket roughly about $3,300 for the year, then they would be done paying out of pocket expenses. But really, it only applies to prescriptions that are on their formulary. So if there's a prescription that's not covered by your plan, well, that doesn't apply to this calculation. You still have to pay for that. So Really, it's for covered prescriptions. The max is right now about 3,300 in out of pocket.
Okay.
Yeah. So it's
So,
way too overcomplicated, but that's kind of the gist of that system.
okay. So is that something though that they could appeal? Are you allowed to appeal? Like, for example, if you entered that catastrophic phase and you were taking a drug that was not on your formulary, would you be allowed to appeal that like you are normally?
Yeah, there are different types of, they call them exceptions, that somebody could apply for. So if a prescription is not on your formulary, you can request an exception. Actually, I had a client call me the other day. One of her eye drops, a very expensive eye drop, a brand name, was covered by her plan last year, and it is not covered by her plan this year. It's not on the formulary. Well, before I could even tell her and call her back, she had already called her prescribing doctor to request an exception, and she was able to get approval. So the insurance company told her, okay, for 2024, we're going to cover this prescription. She hasn't found out what her price is going to be yet, but that is one of the types of appeals, a formulary exception that somebody can request. There are other types of exceptions that can be made. There's tier exceptions, so you can try and get something reduced down from a tier 4 down to a tier 3, which is a lower, probably a lower cost. Or there is, what's the last one? There's formulary, tier exception, and yeah, maybe it's
Mm.
for brand name. So a lot of times insurance companies will want you to try out the generic first. But sometimes people have bad reactions to the generic, so they got to take brand name. You can get, a lot of times you can get the brand name approved. If you're able to show proof that, hey, or the doctor can write in saying, hey, these side effects occurred on the generic that don't occur when the client is taking the brand name. And a lot of times you can get that approved as well. So a number of different
Okay.
things. Yeah.
That's good. There's hope if
Yeah.
you find
There's
yourself in
channels.
a bind.
Yep.
Yeah.
Yep. So
Can
there's
we
some
back up
steps.
a little bit
Mhm.
and talk about the cap on insulin? So how long has that been in effect?
So I think that went into effect, I want to say in 2022 or 2023, that went into effect where certain insulin is capped out at a $35 copay at most. So the most somebody could pay for certain insulin um, injectables, things like that, are $35. Yeah,
Wow, per month?
per month. Yeah.
That is incredible. My father-in-law is a type 1 diabetic, and
Mhm.
he has been, for years, has been paying thousands of dollars every
Yeah.
month for his insulin. He's not Medicare eligible yet, but I think I had been doing some research and I was telling him about this, and he got so excited.
Yeah, yeah, it can be a huge break. And on the Medicare website, Medicare.gov, you can actually enter in your prescriptions. And this is something that we help our clients with. You can actually enter in your prescriptions and get an idea of what your copays are going to be for your prescriptions before you get to Medicare. That's kind of how you would pick out a prescription plan, is, enter in the prescriptions, what pharmacy you like to use, and then figure out, okay, this is going to be the most cost effective option based on the prescriptions I'm taking. So he can do that. If he's getting close, he can get an idea of what he might be looking at out of pocket for his specific medications even. Yeah.
That's really cool. That makes me happy, especially for him,
Yeah.
because that's going to be a huge burden off of his shoulders.
Yeah, absolutely.
Help me understand extra help. Um, I know that for folks that struggle to pay their Medicare premiums, there is help. A lot of people don't know about it. And it seems as though in 2024, um, there's a new drug law that's expanding the eligibility for
Mhm.
extra help. So do you know a lot about extra help? Is that something that you have dealt with at all in your day-to-day?
So
Um,
extra help. It's a program available. You qualify based on income. So a lot of people, and I think pretty much everybody, gets a letter in the mail when they join a prescription plan that there is this program called Extra Help, but not everybody qualifies because not everybody's income is under a certain threshold that would qualify them. So if you feel like, hey, maybe I might qualify, then what you want to do is, I believe, you reach out to the Social Security Administration and see if they can help you apply for extra help, or even go online. I think there's a way to apply for extra help online. And if you get approved, it basically, the extra help program, it can bring your premiums down to zero for certain prescription plans and really eliminate a lot of the out-of-pocket expenses for some of your prescriptions.
Wow, that's fascinating and really
Yeah.
helpful. This is something that I just can't wrap my brain around. Okay, so you touched on this in what you were just saying, that if you need to apply for extra help, you would contact the Social Security Administration.
Right.
It seems like the pathway to Medicare is always through the Social Security Administration. Is that true? Like, you don't ever contact Medicare or CMS directly. It's always through Social Security. Is that true?
Well, so applying for Part A and Part B, that's all done through the Social Security Administration. So either
Okay.
online, in person, by phone. So that is dealt with through Social Security. Obviously, applying for Social Security benefits is done through Social Security. Applying for extra help, done through Social Security. So the Social Security Administration's got a lot of work, and they're dealing with the public, and they're the ones responsible for a lot of these enrollments and qualification. People can even appeal their Medicare premiums, their Part B premiums. So higher income earners, while they're working, they're earning a higher income, but as soon as they retire, they're not earning the same income. Well, what happens is Medicare charges based on previous year's income. And so when people can actually appeal that, guess who you have to go through? Social Security. So
Not
everything
the
is handled.
IRS, Social Security.
Now, the IRS coordinates with Social Security to report income, but you go to Social Security and have them review it. So there's a lot of requests that go through the Social Security Administration, and Medicare technically does not touch that. Medicare is really there if you want to call Medicare. They can tell you about your claims history. Maybe there's something that wasn't covered by Medicare. You can find out why it wasn't covered. So more of the services that would be related to your actual medical services, the Medicare can come in and help. But as far as enrollment, what your premiums are going to be, that's all administered by the Social Security admin. They handle a lot of that.
Okay.
Yeah.
That's fascinating to me. It seems like that's so much for one agency
Yeah.
to
Well,
have to
they
handle.
are overworked and understaffed, unfortunately. And there's always talk, and I think we might talk about this later. There's always talk about, what do we do with Social Security? How do we keep Social Security and the not only the checks coming in for Social Security recipients, but how do we keep the administration afloat and well trained and not overworked? And it's a constant battle, I think. So
Yeah, it makes sense since they're handling so much for
yeah,
so many people. They're kind of the gatekeepers for a
right.
lot of things.
Yeah.
So,
And the baby boomer generation, they're coming to age, right? I think the stat that's been thrown out there is 10,000 people a day are turning age 65 for the next decade or so.
thank you so much for joining us for another episode of the Medicare Navigators podcast. We have a weekly Medicare 101 webinar that we would love to have you join us on. Go to our website at www.martinmedicare.com to reserve your spot today. Please join us again next week as we continue this conversation. All information related to this episode is listed below in the show notes.